Breaking news from the global health front. A high-stakes containment operation is underway following a rare viral outbreak at sea. In this video, we are learning what CDC and authorities are doing post-Hantavirus outbreak. I am Dr. Swastika from Project Health MD. Since the start of the Hantavirus outbreak linked to the MV Hantavirus cruise ship, the CDC has taken decisive action. The agency has activated its Emergency Operations Center, shifting into a Level 3 emergency response posture. Medical teams have been deployed to the Canary Islands to assess American passengers and coordinate with international partners. The mission: to assess every American passenger and mitigate the risk of a domestic spillover. The CDC is actively tracking and notifying state health departments about returning U.S. travelers, ensuring no contact is left unmonitored. CDC teams are now monitoring potentially exposed individuals across multiple states as the virus's long incubation period poses a challenge. The agency has also released detailed traveler risk assessment guidance and published a Health Alert Network advisory. These directives are helping clinicians and public health officials identify and manage possible cases with forensic precision. In addition, the CDC hosted national stakeholder coordination calls to align the domestic response. The agency has refined exposure assessment tools and released a comprehensive hantavirus outbreak toolkit for the public. A specialized response team was also deployed to Omaha, Nebraska, preparing for the arrival of the most high-risk passengers. Their mission: to meet returning American passengers at the National Quarantine Center for further assessment and long-term monitoring. This cluster involves the Andes strain of hantavirus, one of the few variants capable of limited person-to-person transmission. While the overall risk to the general public remains very low, health authorities are treating this situation with high caution. The cruise ship outbreak has raised serious concerns about biosecurity on expedition vessels in remote regions. Operating in these isolated environments creates unique challenges for medical evacuation and containment. As investigations continue, officials urge anyone who was aboard the vessel or had close contact with passengers to monitor their health closely. Seek medical attention immediately if any symptoms, including severe respiratory distress, appear. The CDC continues to coordinate with international partners, including the WHO, Spain, and Argentina, to contain the situation. This unified front is critical to preventing the further spread of the Andes strain across international borders. This is an evolving story. Investigations into the source and transmission chain are ongoing. Stay informed through official health channels. Subscribe to Project Health MD for evidence-based medical updates.